From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Melinda Akilami.
Hello and welcome. House of Reps seek 2-month free power supply to Nigerians as a result of COVID-19. Lagos State Governor rolls out more palliative measures to cushion impact of COVID-19 crisis on residents, says over 400 vehicles arrested for flouting stay-at-home order. Federal government moves to raise 500 billion naira intervention fund to tackle COVID-19 crisis as the Minister of Finance meets with the National Assembly to seek approval for initiative. Implementation of stay-at-home order commences in Ogun State as residents leave roads and business places in compliance with the President's directive. And number of coronavirus deaths in Spain fall for a second day in a row as Prime Minister Pedro Sanchez says the country is close to packing the peace of infections. Plus, business, sports and international news.
Business news tonight. Securities and Exchange Commission confirms readiness of rules for derivatives trading as it says the project is at the finishing stage.
And on sports news tonight, Los Angeles Lakers legend Kobe Bryant to be posthumously inducted into the Naismith Memorial Basketball Hall of Fame.
These may be difficult time for residents of the nation's commercial center as a result of the ongoing lockdown of the city. But the Lagos State government has rolled out additional palliatives to cushion the effect of the crisis on the people. Governor Babajide Sanwo-Olu, who addressed a press conference in Lagos today, says the measures will go a long way in reducing the harsh impact of the lockdown, especially on residents who might be in need of medical attention. Under the initiative, treatment for pregnant women, those in need of surgeries and others will receive the services free of charge.
The Lagos State government will, for the duration of this lockdown, at the first instance, throughout the month of April, we will take full responsibility for the medical bills of all patients who fall under the following category, and they present themselves at all our secondary health facilities, meaning our 27 general hospitals and the maternal and child health facilities that we have around the state. Emergencies, casualties, cases including registration, laboratory tests, surgeries will be treated free of charge. Maternity cases, all pregnant women that have to do delivery in this month of April, either cesarean or normal delivery, will also be attended to free of charge. I want to implore you to continue to obey all the directives that have been issued by health experts. Let us continue to practice social distancing. Let us continue to shun large gathering. Let us cover our mouths when we're coughing or sneezing. And let us self-isolate and contact a doctor if you feel unwell. And to those who insist on flouting our directives and guidelines, we seek to take undue advantage of other fellow Lagosians at this time, and all those who aim to undermine the efforts of the various health authorities responsible for keeping us safe. Let this strong warning go out, that the strong arm of the law will catch up with them sooner than later, and they will be brought to the full justice swiftly and comprehensively.
The Lagos State Governor also emphasized the need for residents to cooperate with government in tackling the pandemic by obeying the order on restriction of movement. Fielding questions from journalists, Mr. Sanwo-Olu insists everyone must be on the same page if the battle must be won.
There have been reports about the person who traveled in from Holland, that he went to several health centers before the government got a hold of him, and that he was cagey with information about his illness. So he has probably come in contact with a lot of people. Should we be concerned about contact tracing case? Because do you know everywhere he's gone to and everyone he's associated with, you know, in the time that he came?
I think it's just a message that we need to communicate to our citizens right out there, that in the event that you contact a medical doctor or you're in front of, please let's give them full disclosure about what has transpired, what is our medical history, where we've been to. That is the only way where they can help you before it gets to, you know, a very critical and an unfortunate incident like this. You know, but I'm sure with the health practitioners, maybe they haven't done a bit of a clocking before it happens. Maybe they will be able to go back and see, you know, with the families that is left behind or so, and try and backtrack and see if there are some other, you know, tracking or tracing that they can do. Today, I think we've arrested almost 400 vehicles, all yellow buses, that the Commissioner of Police reported to us, and they've also been further given the directive that the lockdown is 24/7. It's not that you are meant to restrict at any point of the day. It's 24/7, and people need to obey the rules. People need to comply fully. We've discussed it extensively this evening, and they are going back to ensure that nobody is left, you know, nobody is spared. If they need to continue to arrest your bosses, they will do.
The House of Representatives is to consider a fresh stimulus bill that will ensure that Nigerians get free electricity supply for at least 2 months to reduce the effect of the COVID-19 pandemic. This is according to the Speaker, Mr. Femi Gbajabiamila, who said the proposed bill is to help in boosting the economy through the informal sector as the country prepares for the aftermath of the coronavirus. The proposed bill, which will be the second stimulus bill by the Green Chamber, is to be considered immediately the House reconvenes from its ongoing break declared due to the pandemic. It has, however, been agreed by the leadership of the National Assembly that the resumption date initially slated for April the 7th will be extended by 1 week in compliance with the government's 2-week stay-at-home policy. The Speaker spoke at the National Assembly today during a meeting between the National Assembly leadership, the Minister of Finance, Zainab Ahmed, the Director General of Budget Office of the Federation, Mr. Ben Akabweze. And still at that meeting, the federal government is seeking to establish a 500 billion naira COVID-19 crisis intervention fund to improve healthcare facilities and provide intervention to states. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, mentioned this at the meeting with the National Assembly today. In a statement, she says the proposed fund will involve mopping up resources from various special accounts of the Federation, grants being expected, and loans from multilateral institutions. Responding, the Senate President, Ahmed Lawan, says the loan request is crucial because the country is at an emergent situation and time is of the essence. He, however, asked the federal government to examine another approach in its implementation of the social intervention program, adding that giving 20,000 naira to poor Nigerians might not be the best solution after all. On Monday, March the 13th, the President announced a total lockdown in Abuja, Lagos and Ogun State for an initial 14 days to enable the Health Ministry effectively prevent the spread of COVID-19 in the country. According to the government, the lockdown will help the Nigeria Center for Disease Control, NCDC, to trace all the contacts, isolate and test them for the virus. This next report examines the efforts to stop the spread of COVID-19 in the nation's capital, Abuja, and the level of compliance by residents with the restriction order.
In the last 1 week, this is how most streets in the nation's capital, Abuja, have looked since the government announced the lockdown on Monday, March the 30th. The city center that was once full of life has almost become a shadow of itself as security agencies enforce the lockdown order of the government. However, it is a different ballgame in some of the satellite towns in Abuja. For most residents, life is still normal.
You can't just say people should stay at home, because in the first place, they don't. If they stay at home, do they have food to eat? You can see that even though they have announced that people should stay at home, people are still coming out. Artisans are still coming out. People are still coming out to look for their daily needs, to look for what to eat. If government want to really do it, they should pay 2 months or 3 months in advance, not even in arrears.
At a news conference on Friday, the chairman of the Presidential Task Force on COVID-19 made this passionate appeal to citizens regarding the stay-at-home order.
I think we've gotten to a point where we must truly be open about some of these things. You watch the news, you see in London, a temporary mortuary is being prepared. Not one, not two. What else do you want to know that this is a serious issue? That as a people, we must be conscious of that, and we must awake from our slumber and deal with this thing decisively and cooperate with government, cooperate with all those that have responsibilities of ensuring that we take the necessary steps.
Some Abuja residents are already seeing the need to comply with the government and obey the order to stay at home.
Right now, we're on our own. Every person is on their own. Every single person is on their own. Yes, the federal government is trying. We too will try. We'll do the best we can. If you tell the federal government to give us so much money like that, will they have money? Fuel prices have gone down. Where will they even see money to even pay people? We need to be smart on our own. We cannot wait for the federal government to help us totally.
So far, Abuja has recorded over 40 confirmed cases of COVID-19, just as the government braces up for possible surge in the number of cases in the days ahead.
We are not praying to get to that, but we must prepare. And there is nothing like over-preparation in this regard. I believe it is better that we get prepared and get over-prepared than not to prepare alone.
The COVID-19 pandemic is sweeping across the globe with an incredible speed, and both government and citizens must work together to stop its spread.
The Nigeria Center for Disease Control, NCDC, has corrected the total number of new COVID-19 cases reported as at yesterday, April the 3rd, to 25 instead of 26, bringing the total number in Nigeria to 209. The new cases were found in Lagos, Abuja, Edo, Osun, and Ondo State. So far, 25 people have been discharged with 2 new deaths, each recorded in Lagos and Edo State. A breakdown of the cases in each of the states showed that Lagos has 109 cases, FCT Abuja 41, Osun 20, Oyo 9 cases, Edo 7 cases, Akwa Ibom 5, 4 each in Ogun and Kaduna State. Bauchi has 3 cases, while Ekiti and Enugu each have 2 cases, with Ondo, Rivers and Benue State recording 1 case each. In Osun State, the missing COVID-19 patient reported to have escaped from the isolation center in Ejigbo has been found. The Commissioner for Information and Social Orientation, Funke Egbemode, who confirmed this to Channels Television, said that all the COVID-19 positive cases in the isolation center have been accounted for. Some online newspapers had earlier reported that 6 people were missing from the isolation center, but the Osun State government dismissed that allegation. She explained that only 1 person was missing from the center after a head count was carried out. In part 2, after the break, More on the lockdown arising from the COVID-19 pandemic and other measures being adopted by various state governments. Stay with us.